Happy to introduce the next speaker, Dr. Ajeet Singh Bhadoria. Ajeet Singh Bhadoria is an additional professor in community and family medicine in All India Institute of... Sorry about that.
Next one.
Ajeet is additional professor in community and family medicine from All India Institute of Medical Sciences in India. And he's also a WHO GVAC member and has contributed a lot to WHO guidance documents and have many publications. And we are very happy to welcome him. And the topic that he's going to talk about present is about decentralization, integration, and task shifting with hepatitis C self-testing, a micro-elimination project among prisoners in northern India. Welcome. Over to you. The floor is yours.
Thank you so much, Guna. So good afternoon, everyone, and namaste from India. So I'll be telling you about the project which we did in 4 prisons of northern state of India. And I'll be telling you about how decentralization, integration, task shifting, and utilization of hepatitis C self-testing in hepatitis C care have provided us increasing, impact on hepatitis C care in prisoners. So just to tell you about the background of hepatitis C in India, the burden globally is, we all know it is around 50 million cases with 1 million incident cases per year. And in India, it is around 5.5 million, and out of which only 36% they are diagnosed and 20% they have received treatment, according to Global Hepatitis Report 2024. If we see the data from a systematic review and meta-analysis, which is done by our group only, the burden among prisoners in India is around 7%, which is more than 7 to 8 times as compared to the burden which is there in the country in general population. Elimination targets talks about that we should increase our diagnosis of those who have infection by 90%, treat those who have diagnosis by 80% to achieve the elimination targets, but we are far away from those targets. So we thought of that we'll do this project among the prisoners, and we'll try to increase the testing uptake and try to link them to care utilizing these innovative approaches. So the innovative approaches which we have used in the prisoners was first the use of hepatitis C self-testing, and then decentralization of testing and treatment both to the pharmacist-led clinic in the prisons, which is available in our country. Mainly we have pharmacists available in these clinics, and sometimes medical officers also, but they are very irregular. And then integration of the services with our national programs. So we have a national viral hepatitis control program which provides everything free, but it's not available in the prison. We have a national AIDS control organization which are doing a very good services in the prisons also. They have ICTC, integrated counseling and testing centers in the prison. So everybody is counseled and tested for HIV. So we tried to integrate this testing with HIV. And we have also used drone and telemedicine to augment or to improve this linkage to care and try to improve our cascade of care. So those who do not know, hepatitis C self-testing is given by WHO as in the guidance document in July 2021 as an additional approach to increase the testing uptake for hepatitis C. So it was a prospective longitudinal study design among 4 district jails in Haridwar, Dehradun, Roorkee, and Haldwani. These are the name of the districts of Uttarakhand state, which is a northern state in India. Study duration we started last year in August 2024 after getting the ethical approval, and it's still ongoing because I'll share in details in the results. And then study population is all prison inmates. So we included all males and females prisoners which are there in all these 4 jails. Those who refused, but nobody refused consent. It was very smooth smooth work done by the authority because they have a very good rapport with these prisoners. And it was a universal sampling. We included all 4,050 prisoners which are there in these 4 jails during our data collection period. And all participants, they were interviewed utilizing a pre-designed and pre-tested questionnaire and then tested by hepatitis C self-testing kit. So those who are reactive for hepatitis C self-testing kit, then we got their RNA testing done, and liver fibrosis assessment was done by using transient elastography machine of our institute. It's a portable fibroscan machine which is taken per month, every month to the prisons. Then drones, they are used to get the samples from the prison and deliver the drugs to the prisons to save time. And also telemedicine was used so that we can have continuously in touch with the pharmacist. Our clinic was constantly was in touch with the pharmacist in the prison clinic, so that we can guide them and get the DAs initiated as early as possible after when they receive it. And then we have also done a usability study for hepatitis C self-testing among a smaller group of inmates, 100 people, 100 prisoners were included. So overall aim was to do micro-elimination for hepatitis C, also to utilize these innovative methods to see how it can accelerate the treatment and streamline the care, and also to find out what is the proportion, what is the prevalence of risk factors, and how it is associated with hepatitis C. So we did the meetings with stakeholders, we did need assessment, and ethical approval was taken. We did the training of data collectors, also engaging with the prison inmates, and then we translated the format which was given to us in the kit into the local Hindi language. And this is the distribution of cases, that's not important. But out of the 4,050, only 185 were females, and nobody was tested positive for hepatitis C. Mean age was around 35 years. Mostly they were below 30 years of age, around 43%, literate 74%, unmarried 40%, and 66% they belonged to the lower socioeconomic status. If you see the proportion of the risk factors among the prisoners, so it was maximum was, they reported that they have, this is self-reporting, shaving tools and toothbrushes, also unsafe sexual practices, sharing needles, and injectable drugs also got tattoo, but this is all history before they get into the prison. There was nobody, even the authority and the prisoners all denied that there is no use of any of these high-risk behaviors in the prison. This is a picture of transit elastography, which we do once every month. This is the pictures of drone which we have used to deliver the samples, to get the samples and deliver the drugs. And this is the telemedicine room which we use every Friday from 12 to 1, and also we plan sessions as and when required from the pharmacists. And hepatitis C prevalence overall was around 3.4%, which is 3 times higher than the general population. All males, usability of hepatitis C self-testing was very good, 80%, acceptability 90%. High literacy and younger participants, they were more comfortable using the kits. And overall satisfaction was also 68%, 66% mentioned that they'll recommend it to others also. So not going into details of this slide, but injectable drug use, sharing needles, and unsafe sexual practices were independent risk factors for hepatitis C infection among these prisoners. So this is the cascade of care. You can see it's not that good as we expected, thought of that it's a closed group and we'll get more better results. And the only problem with this cascade of care was the prisoners, they were released from the jail. Most of those who have infections, they were on trials. They get released from the prison, and they documented high risk behaviors also, and so we have missed out them. We tried to contact them through phones and other means, but still we are struggling with it. So overall conclusion is that 3 times burden among prisoners, high prevalence of risk factors, strong association with modifiable risk factors. Feasibility of hepatitis C self-testing is good, acceptable. Model of care by using decentralization, task shifting with pharmacists, integration, and other methods, they were effective. And the release from the jail of these prisoners were challenging. We are still trying to find out. We are planning to do a qualitative assessment of loss to follow-up cases to find out what are the reasons why they do not even talk to us on the phone also. Even sometimes the pharmacists, they mention that they can deliver the drugs to their home also, but still they do not respond. So these are all my references. Thank you so much.
Thank you very much, Ajeet. Now, time for questions.
Thank you for a wonderful presentation. Sean Falade from Baltimore. What was the HIV self-test? What kind of test was it specifically?
Hepatitis C self-test.
So was it, because it looked like a DBS?
No, it was a blood, it's a blood-based test, whole blood-based test. So you have to just like the way you do diabetes testing or other HIV self-testing. So it's a kit, you have to just open it, you have to prick it, and then you can put the drop on that, and you can get that yourself tested.
So it was a point-of-care antibody?
Yeah, it's point-of-care antibody testing.
Thank you.
Ajeet, amazing job. Oh, sorry, Jason Grebley from Kirby Institute. Yeah, great presentation, Ajeet. Very fascinating. I have 2 questions, if I'm allowed. The first one is you got to tell me more about this drone. Like, how freaking cool. So I know you went really fast.
I know,
like,
I was just...
But like, I know. So tell us about this drone. How does it work? Like, why did you guys think to do that? And what was the problem that you were trying to get around? And how do they get the samples back? The drones in Australia, they just shoot them down because they're dropping drugs in. So into prisons, yeah.
So I mean, you have to take all the permissions. So we have drone facility in our institute from last 2 years, and it has done more than 100 flights for different reasons. So we thought of to use this also for prisons also, because our terrain, Uttarakhand state has a terrain which is hilly areas. So a few of our prisons, they are in the hilly areas. So going through the vehicle and sometimes getting these prisoners to us for testing is very difficult. So we thought of, if we have the facility, why not to use it? So it can carry 3 to 5 kg of weight. So we send the drugs, and drugs goes to the prison, not in the prison, outside the prison to the police guys where they live or their offices are. Okay. And then they take those drugs, put the samples back, and it comes back. It's a predefined route for there. You can see in this picture, it's everything mentioned, the route it takes, and there is a center in our institute which monitors how it is going down. It has gone over there. They have collected this. These are the drugs which this jail superintendent he has collected, and these are the samples which we have collected when it came back.
Cool. Do I have time for another one or no?
Yeah, you can.
Okay.
We still have little time. Yes, please.
Okay,
Yes,
I just
Jason.
want to make sure. You're the chairs, you're the bosses. Okay, so the other one, so it's quite interesting. So we've done a bit of work asking people, do you want self-test or do you want the staff to just do it right there? So when we've done it at facilities, it's kind of like, well, I'm here. Actually, Annabelle's the one that's been leading this work. And about 85% of people said, just, I'm here, just stick my finger. I guess the difference here, and now that you've explained that, I've maybe answered my own question, in that you've dropped the tests off. You're not asking the healthcare providers to do it. You drop it off and they kind of do it themselves and register for the system. So how does the self-testing aspect work? Because I think it's different maybe in this setting how you do it. And it's great to have this data because we don't have a lot of data around self-testing in people who inject drugs or people in prison. And okay.
So actually I was the guideline development group member for the self-testing in 2021. Then I joined technical working group, and the interest developed in hepatitis C self-testing. So I planned 2 studies. One was in urban slums, looking out for how this works in urban slums, usability, acceptability, plus how the treatment uptake is increased if hepatitis C self-testing is available in the community and in the UPSCs. And then I thought of why not to use these kits in the prisons also. So I agree with you, like for prisoners, it's like they are in the closed group, the lab technician can do it. But most of the times, even lab technicians are not there in the prisons of our country. So self-testing is very easy, can be done by the staff also, but can be done by the prisons also. And they find it very comfortable. They were very enthusiastic in sitting in a small 10 to 20 groups, and the kits were distributed. They were explained about how to use it, and they were performing by themselves. The most difficult step was to collect the sample. Sometimes prick was not good, sometimes they were not able to. Otherwise, they were like very happy to do it by themselves and showing the result that whether they are positive or negative.
Anyways, congrats. Very innovative work. Very cool.
Thank you, Jason.
Thank you.